So my next question for you, once you got into the career field, do you think it was everything that you felt or that you thought it would be?
No, actually, no, it wasn't. It's but I've learned so much from it, and I'm glad you asked me this question. This is one I'm very passionate about. Um, when I got into healthcare administration, I thought, just like Dr. Whitaker shared with you, oh, I'm going to be the CEO one day. I'm going to
Yeah.
own my operations. What my vision, I'll be able to, drive it forward and get my team's buy-in and lead a successful team. Not the case.
Mm.
You used the word earlier, that it actually took me a while in my career, to really understand, and that's collaboration.
Yeah.
I had to take a lot of bumps in the road, go through a lot of challenging situations to really figure out the meaning of that word and how to make it work, especially in healthcare, because there's so many moving parts. And I say that to say I grew up playing sports all the time, and then in the
Mhm.
military, part of the ultimate team. So I'm a team player, and I always put others before myself. But
Yeah.
as an administrator, you really are in a unique situation where you actually work for everyone. No one
Yeah.
works for you. Your staff, you work for them. Your patients, they're at the center of it all. You're always working for them. Your leaders, you're working for them. Your providers, you're working for them. And you have to keep all of those elements happy. The
Hmm.
organization has key metrics that they
Yep.
need you to meet, even though you may not have the resources, whether it's a people resource, whether it's equipment, whether it's systems, and you're always figuring out ways to navigate through that. And then you have your physicians, and who could be the biggest challenge at times, because
Hmm.
many of them, they lack the business understanding, and they don't even like to take into consideration the metrics and the agenda that's being pushed down from up top. They
Yeah.
tend to ignore it a lot. And
And
as
you,
the administrator,
yeah.
okay,
Well, I'm sorry to kind of interrupt you, but you really hit, and this could probably be a whole series on its own.
got you.
Because you're right, because the physician, they do lack the business understanding, and I guess with them, I think a part of it, especially with large healthcare systems, is so interesting to me how the organization has an agenda of what they're trying to do, but yet the providers, oftentimes, they either may not be privy to that, or they just don't understand it, or the physician, they'll just push back, and you as the
Hmm.
administrator or even practice manager, you're in between. So what the organization is trying to do, right? And you're talking to your staff, and you're trying to talk with the providers, but yet you have to provide, like, hey, listen, I don't care, I'm not doing this. This is extra work
Hmm.
for me, I'm not doing it. And then it poses a challenge, right? And so I think this is where, you know, it's building relationships with providers is so important, because it does make it easier to have those difficult conversations, and
Hmm.
maybe even having that influence to where, yeah, the physician may not want to do it, but because of the relationship and the influence that you do have with that provider, it eventually can kind of help bring them along to eventually get things to go. And sometimes you have to kind of get creative to still get those metrics completed at the end of the day. But I just wanted to toss that in there, because again, yeah, you're right, man, it's just tough sometimes, as an administrator, just trying to manage everything, and especially with the
Hmm.
initiatives and metrics, but trying to get the providers involved.
Hmm. And then a big challenge when you ask the question, is it everything I thought it would be? A challenge for individuals like you and I, coming up, out of high school, going into the military. We're used to a hierarchy where basically the person you were reported to in some way has done your job before.
Hmm.
As to where, as we know in this world, as with most industries, but specifically in the world of health administration, anyone can be an administrator. So
Yeah.
it's not just someone who goes to school with and gets a degree in healthcare administration or MBA or business degree. You
Yeah.
nurses, the majority of the administrators in healthcare are nurses or
Hmm.
physicians. Now you even have lawyers coming into healthcare, because
Hmm.
it's such a heavily regulated industry, and this the world we live in is so litigious that these
Yeah.
organizations are hiring lawyers to fight big cases, and more so for compliance reasons and to be proactive and preventive,
Right.
put in preventative measures. Pharmacists are now tapping into the world of administration, whether on the hospital side and now even in the ambulatory side.
Hmm.
I actually, the organization I work for with Walmart Health, they've always their model with healthcare has always been in the pharmacy world and the optometry world. So naturally, when they decided to embark on ambulatory clinics, they pulled those resources. So a lot of our senior leadership is comprised of pharmacists and optometrists. So when you embark in this, having someone to tell me that in the beginning would have been helpful, because I've been, you know, xed out and limited to roles I can apply for because I don't carry a nurse's license or I'm not a
Yeah.
physician. But when you read the job description, and even when you work with that person, you realize I could do that job in my sleep.
Hmm.
Because
I
you
agree.
mentioned earlier that being a corpsman is similar to a medical assistant, and I know that's honestly for our audience to kind of get an understanding, but I think we sell ourselves short, because as we know, Corman can do a lot, and that's a
Absolutely.
big reason of why we're both here today.
Yeah.
Outside of our hard work and dedication, the
Hmm.
military. I know for me, it definitely put me in a position to succeed. But to ultimately answer your question, no, healthcare administration is not everything I thought it would be, but it is my career. It is what I'm
Yeah.
passionate about. And
Yeah.
now, as I grow as a professional, I'm learning to embark on avenues that allows healthcare administration to be everything that I thought it would be when I first got into the field. So now I'm on a path where I'm actually doing what I want to do, and that's rewarding. So yeah.
Absolutely. I think just like you too, I realized, I don't know, a couple of years into it that, okay, yeah, things may not necessarily go as planned as as you thought. Because just like you, I was like, man, my goal is to be a CEO of a large healthcare system, all that stuff. But then I remember my first practice management job. I was like, oh, okay, this is different. And then I remember, when I first started working for HC as a practice manager. The time I was in Jacksonville, man, I was so overwhelmed. Like I went home sick on my first day because I was like, I think at the time, maybe 22, maybe 23 years old. And I was like, man, I'm responsible for this practice. All the employees, they were older than me. And so they was like, who is this kid coming to manage us? And I remember just being just overwhelmed. And I went home and thinking to myself, man, can I really do this? And after giving
Mhm,
myself a pep talk, I was ready to go ever since then. But there's a lot that you do deal with. And sometimes you may have difficult staff. And I'll tell people this all the time. Getting into this career field is one of those things that you have to learn people skills, right? You have to know how to manage people. Everybody cannot be managed the same way. And so you have to learn people personalities. And I think once you learn that, you build that relationship, then I think it makes it a little bit easier. But definitely physicians do make it difficult, 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 difficult. And I've dealt with them.
mhm,
And then you and I know, especially working for these large healthcare companies, at the end of the day, you are the scapegoat, and because, you could do everything that you possibly can, and you're stuck in the middle. And when you're dealing with these physicians who have such a large influence in the company, because at the end of the day, the physicians, they're the ones who make the company money. And and the physician can have a piss poor attitude. They may not want to necessarily do what the company is asking every provider to do, but because there's one or two, providers who have such a large influence, they could say whatever they want to say. And because of that, oh, you know what, you're gone. And it's just like,
Mhm.
man, it's crazy. And so kind of dealing with, working in a company that have that type of culture is very, very difficult. And it's one of those things that you better hope to be in a situation where you don't have providers like that. Or if you do have providers like that, that they love you, because
Yeah.
they can either make your career or they can break your career. And so for me, I would just say that's probably one of the things in the healthcare industry that, I guess, in the healthcare administration career, that I personally do not like. And after a while, you get tired of it.
Hmm.
And but however, I would say in my 15 years, I've learned so much. I've made a lot of great, relationships. But I just knew that corporate stuff is done for me, because it's so cutthroat.
Yeah.
And sometimes it's not for everybody. You're either
Nah.
cutthroat and you want to do things, or like myself, I said, you know what, I think I'm better off creating my own table so I can have my own
Hmm.
seat,
Hmm.
and be able to help out providers in a different way, helping them start their practice, helping them to manage it, and just really helping them to be entrepreneurs. And so, ever since I've done that, it's been great, and I'm happy. Sometimes I
Hmm.
wish I should have done it sooner than later, but at the end of the day, I know there's time for everything, and so I'm just glad for all the experience that I've gotten, being a healthcare administrator. So, how about you,
Man.
man? What are some things that you didn't like, just being a healthcare administrator?
Definitely. Great question. So, some things I hate, man. So I'm a healthcare administrator. But oftentimes, you find that you're a babysitter, to the point you just made. No, honestly, I mean, I told you I was going to be honest. So, and what I mean by that is, not only do a lot of times in the corporate structure of things, and this is
Mhm,
where the frustration it comes in, is you have people who sit at the top. But going back
mhm.
to the point I made, however they got there, that's not, you know, I can care less about how they got there, but it's a lot of times they're there and they skip so many steps. So
Yeah,
they don't even have a clear understanding of the operations they're managing. They
yeah,
focus so much on the numbers and the key metrics that they've set in place, but they don't understand the day to day and ins and out. So even when you try to be proactive, you find that the majority of the time in this field, you're more reactive than proactive. Even
yeah.
when you pound the table for certain things, you ask for certain resources. You can even illustrate and paint a picture and tell your leadership, hey, this is what's going to happen if we don't start doing this. You can tell your providers,
Mhm.
this is what's going to happen. And then you find 3 months down the road, 6 months, or whatever the case may be, it happens. But everyone forgets the conversations or the numerous conversations you had with them about this possibly happening, and you become the scapegoat.
Yeah,
And I
yeah,
hate it so much. I hate it so much. Agendas come from up top that you may not agree with, you don't even understand, but they ask you, as a leader, to support it and put it out to your team. But what they fail to realize is you're the one on the ground. The physicians are going to ask
mhm.
you all the questions. The staff is going to ask you the questions. The patients are going to ask you the questions. And now you're in a position where you have to be cautious in your response.
Yeah,
Because if you're overly supportive and you say the wrong thing, it makes it easy for leadership to come in and say, well, you told them that we didn't really quite set it, instead of stepping in and supporting you and saying, hey, man, this came from us. It was a bad idea.
right.
Dom was really trying to support us and it
Yeah,
didn't work out, so this is on us. That never happens, and then you find the flip side where you just totally don't agree. Everything your providers are saying, everything that the patients are saying and the staff is saying, you share their sentiments wholeheartedly, but you can't
mhm.
say it. The moment you
Right,
you
right.
you show a glimmer of agreement,
Yeah.
that's used against you. There's
Yep.
been plenty of times where me and providers equally have a conversation and the arrow points back to the leadership, that
Mhm.
made this decision. But then when we get in a meeting, the provider have just thrown me under the bus, and I was talking with
Yeah,
Dom, and
I
this is like,
know.
Wait a
No,
minute, bro. You were doing the
I
majority of the
know.
talking. I was just listening. How did you come vent to me yesterday and make it like we were an
Man.
alliance and we on the same page? And then we get in this meeting, and that is the biggest thing. I've
Yep.
noticed providers, man, they talk the biggest trash to their administrator on the ground and their team on the ground. But when they get in front of leadership, they even change their tune.
Yeah. Yeah.
And it puts you in a bad place. It puts you in between a rock and a hard place.
Yep.
You have to get used to people within your team, especially the providers, being disgruntled, and their
Hmm.
most of their anger and frustration is with leadership. But what happens a lot of times is leadership meets with them privately without you
Yep.
being present, and then
Yeah.
you come back to a meeting on your calendar from leadership wanting to talk to you about all these issues, when in
Hmm.
reality the provider is really upset with you all, and
Yeah.
you're looking for a way to put it on me, and I'm not even
Yeah.
privy to this stuff.
You're
And it's
right.
just like, this is a
Oh my
headache.
God.
This is not what I signed up for. And sometimes it outweighs, brother, the rewarding piece of the job. Like me, every
Yeah.
stop I've had, I sell my speech. I get my team to buy in. People start going to school. They take their
Yeah.
first college class. I've had
Hmm.
staff come to me crying like, man, after high school, I struggled to get out of high school. I never saw me going to college. And you
Hmm.
told me to start off with one class and you'd be there for me. And here I am.
Yeah.
I'm 2 semesters from finishing college,
Wow.
like in tears, the first graduate of their family. And I don't take credit in any of that. I take pride in using my platform to have a conversation with people and get them to just believe in themselves, getting people to rise to the occasion and bring the best out of themselves. So that's very rewarding for me, and I think that's why I've stuck around so long.
Hmm.
But now I'm at a point too where Renee, I've kind of always followed your lead. Kind of, you laid the blueprint out, and I'm right behind you. So I mean, entrepreneurship is honestly, earlier I mentioned, how do you get what you want out of being a healthcare administrator? And
Yeah.
for me, it's definitely entrepreneurship and building your own brand and creating your own table. Corporate America is great, especially in healthcare. There's a lot of challenges, so you're going to learn a
Hmm.
lot.
Right.
Even though
Right.
all these stops, have been chaotic in a sense. I've had several jobs since I've gotten out of the military. I've learned from each one. I
Hmm.
can't deny that. I've met some great people and networked. And while I've bashed providers, not really bashed them, I have great relationships with a lot of the providers I've worked with in the past, and
Right.
I
Right.
continue to keep those
Yeah.
relationships because they're going to be beneficial to me and what I'm trying to build moving
Yeah.
forward. But it's very definitely a rewarding career field. We talk about this all the time, but
All the
those
time.
challenges, anybody out there who's thinking about getting into this, take heed to what we're saying, man.
Yes.
It's a challenge,
Absolutely.
man, and a lot of times we touched on the word collaboration earlier. A
Hmm.
lot of times, let's make no mistake about it. Since we're keeping it real, there are disparities out there, and I've noticed that certain my colleagues can come to meetings and say things what they want to say, how they want to say it, whenever they want to say it. And me, if I
Hmm.
keep my level at a 3 and I'm saying something that they just don't want to hear,
Yeah.
oh, you're
Yes.
combative, or you're not supportive, you don't align,
Oh
you're not
man.
collaborative, you don't believe in other people's opinions and things like that. And you're saying everything to me that you do to me. I never do this to you all.
I know.
I've learned that they use the word collaboration, but what it has meant,
Preach.
in context when they're talking to me is simply,
Yeah.
as long as you're agreeing with us, you're collaborative. But as soon as you think outside the box, you struggle with collaboration and being a team player and supporting the organization. And I'm just tired of that. I'm so past that,
Yeah.
because, with me, man, I don't. Another thing in this field too, man, you got to get used to. You know how many times I've come into a new position or I've met someone for the first time. We probably
Hmm.
talked a lot via email or messenger, but we've never seen each other face to face.
Right.
And everybody will come and they don't even look at me in my face. They're staring at my ID badge to kind of see what my title is, to see what level of energy they're going to give me. And so many times it's been, as a
Yeah.
senior administrator, people, oh, you're dumb. Yeah, but you didn't want to talk to me at the door. But now
Right.
you need
Right.
something
Right.
from me.
Yeah.
Yeah, I was the
Yeah.
guy that you kind of shoved off at the door when I tried to greet you and take care of you. Then you circle back and realize I'm the guy that you were coming here to see all
That's
along.
funny. I
Yeah,
know.
it's very funny, man.
Yeah,
It's
it's
funny, but
Awesome.
Man.
All right. Well, thank you guys for watching Healthcare Experiences. I'm Rene Lumene, and I'll see you next time.